One of the most frequent causes of leg and back symptoms is a herniated disc. Here, high forces can cause the outer fibrous ring to rupture and the fibers and core material to exit into the spinal canal. First, a guide wire is used to ensure the correct positioning of the instruments. Thanks to special instruments and devices such as the dilator and working sleeve, this procedure offers the most minimally invasive approach compared with conventional methods. An essential component is the endoscope, which guarantees optical control of the treatment at all times. This allows the procedure to be performed safely and easily.
Good morning everyone. Thank you for joining us live on this episode 4 of Ask the Expert. So today we'll be talking about bones, joints and spine care, the common problems, modern techniques of treatment and myths related to the same. So today we have us joining here our head professor and HOD, Dr. Hiranya Kumar from the Department of Orthopaedics to enlighten us on these particular topics. Sir has an experience of more than 25 years in the field of arthroplasty, sports medicine and spine care. I'm Dr. Nishant. I'll be the host for this episode. So let's go live and let's introduce sir. So thank you for joining us today, sir.
Yeah. Good morning, Dr. Nishant. Good morning, all the viewers who are in the YouTube. Yes, as Nishant told, it's a very good topic. The common problems every one of us will face: back pain, knee pain, and osteoporosis. I would be very happy to have some discussion, clarify some doubts, answer some of the questions the viewers, if there are any calls from the viewers. Let's start, Nishant. Yes.
Okay. Thank you, sir. So now, sir, let's start with the most basic thing what everyone is suffering today. What exactly is osteoarthritis, sir, in your understanding?
See, osteoarthritis is a age-related change in the joint where the cartilage gets worn out. It's a wear and tear. The cartilage gets thinned out. Commonly affected is the knee joint. Usually happens after 50 years.
Okay, sir. So usually in your clinical practice, who are the patients who are most vulnerable to this particular condition?
Yeah, age is the main thing, but there are people with obesity, body weight, more body weight, those who are sedentary lifestyle, previous injuries, more common in females. Old sports injuries, ligament reconstruction, usually they will start developing some wear and tear. Okay, commonly it's age related. Some genetic predisposition is there, it runs in families. We will see some patients having not any arthritis at 70 years, some people will have even with 50 years. So some genetic predisposition is also there.
So I just have a small case or something for that. One of my friend, he's around 28 years old. He's an athlete. Okay. So he usually goes to the doctors, multiple doctors saying that he has knee pain on and off, on and off. So does all knee pains lead to arthritis or is it something else?
See, not all knee pains or arthritis. Some could be ligament issues, some could be the cushion, the meniscus, some could be chondromalacia, we call that the cartilage, the kneecap cartilage, sometimes it becomes softened. So there are so many causes. It could be just a small sprain, sometimes it could be some calcification, sometimes loose bodies. So there are various causes. For a 28 years, usually it is not an osteoarthritis, it could be some other reason. So it should be evaluated properly. It could be a minor ligament tear or a meniscus tear. I feel it should be that this one.
Okay, sir. So now coming to, now that we have, say a patient comes to you and you tell them that they have arthritis. So what are the treatment options available to them, sir?
See, when the patient comes, we would like to take a basic X-ray to find the extent of the disease. Okay. See, when the first time comes, maybe a duration symptoms are maybe 6 months, 1 year, the arthritis will not be much. So as we see this is what in arthritis picture, you can see the cartilage, you can see the cartilage, no damage seen. This is usually what we see in a normal individual. As the stage means, in the early osteoarthritis, you can see there is some wear and tear, you can see some loss of cartilage. As the disease progresses, we call advanced arthritis, the whole knee gets fully affected with formation of osteophytes, bony outgrowths, ligaments will become lax, meniscus will get worn out in case of advanced arthritis. Maybe yes, for the first time when the patient comes within 6 months, 1 year, usually they will be grade 1, grade 2 early osteoarthritis. But as the symptoms persist for 4 years, 5 years, 10 years, the disease would have progressed to an advanced arthritis. So the treatment depends upon the stage of the disease.
Okay, sir. So right now in this modern times, what are our treatment options? Does all knee arthritis require surgery, or is there any alternative methods for the same?
See, this is the common misconceptions patients have. If you go to a doctor, you will take an X-ray, you will tell surgery. No, that is not the case. See, early osteoarthritis or short duration symptoms, usually the treatment is exercise. Exercise is the core treatment. Yes, there are medications, topical medications, oral anti-inflammatories we give. There are a lot of supplements, there are a lot of injections. Surgery is usually the last option. First, it is the exercise, lifestyle modification. If patient is weight is on the higher side, reduce the weight, do good exercise. Exercise is the core treatment for all age groups and all stages of disease. Exercise is the main treatment.
Thank you for that emphasis on exercise, sir. You mentioned something about these pharmacological methods or tablets, sir. Can you just elaborate on that?
See, there are a lot of supplements, and every patient comes and asks, can you give me that super supplement, superfood supplement, which can arrest my disease? See, again, few patients get good relief, few patients don't get any relief. Again, it also depends on the stage of the disease. Yes, in the stage 1, stage 2, very early stages, patients do get some symptomatic relief. It doesn't mean that cartilage is growing. So, see, all these are marketed or given to the patient telling that the cartilage will regenerate. Patients might get some symptomatic relief, but it doesn't always mean. So the common, this one are, we give, glucosamine sulfate, chondroitin sulfate, boswellia, alpha-pin, collagens. These are all some of the market. As I told, the evidence and the results are very mixed. But we do give because it doesn't have any side effects. Most of them are nutritional supplements. Patients come, my son has sent from US, can I take this? My son is telling to take for 6 months, 1 year, can I take this? Yes, we tell, because it is just a nutritional supplements. Yes, in my practice, many of the patients show some improvement, especially glucosamine sulfate, chondroitin sulfate, collagen also. Sometimes they tell that it helps in the protein synthesis, which help in cartilage formation. So these are some of the supplements which we use regularly, Yes, it's mixed results.
Okay, sir. So now a general misconception or some doubt what most of the people have. I've overheard many people talking about the same. Is knee osteoarthritis a reversible condition?
See, a cartilage worn out, it cannot be reversed. That is for sure. This misconception should be, we should pass on to our general public. Yes, it cannot be reversed. You can definitely prevent its progression. You can slow down the progression. So that's what, see, everybody thinks that by taking supplements, injection, my knee can become normal. My knee can become as when I was in younger age group. But that's not the case. So it is not a reversible condition. Once a cartilage worn out, usually you can slow down, but you cannot bring it back to normal cartilage.
Okay, sir. So recently I met someone who said that they got an injection in their knee for knee pain and knee arthritis, sir. Could you just tell us what that injection could have been, or what are the common injections available to enlighten us?
Yeah, there are a lot of injections. It is there since years. New things are coming up. Common is the steroid injection. A patient comes, I have a marriage. I have to be active. My knee is aching. Can you do something? Yes, we give steroid injections. Yeah, 1 or 2 injections, steroids will give a good anti-inflammatory effect. You'll be active for a short term, 4 weeks, 6 weeks, 10 weeks. There are injections which has got biological effect like PRP, BMAC. These are some of the, again, these injections also has got mixed results. Few patients respond well, few patients doesn't respond. Again, they tell that cartilage regenerates. Again, that is a big question mark. Yes.
Excuse me, sir. We're getting a call from one of our callers. Just answer it.
Yes, Deepak.
Hello.
Yes.
Sir, good morning, sir.
Good morning.
Sir, my name is Deepak, sir. I'm from Whitefield, Bangalore.
Yeah.
Sir, actually, sir, ನಾನು ವೀಕೆಂಡ್ಸ್ ಅಲ್ಲಿ ಕ್ರಿಕೆಟ್ ಆಡ್ತೀನಿ ಸರ್. ಸೊ ನಾನು ಬೌಲಿಂಗ್ ಹಾಕಿದ್ಮೇಲೆ ನನಗೆ ಸಿವಿಯರ್ ಇದು ಪೇನ್ ಬರುತ್ತೆ ಸರ್, ಕೈ ಹೆವಿ ಪೇನ್.
ಓಕೆ. ಕೈಯಾ?
ಹೌದು ಸರ್. ಬೌಲಿಂಗ್ ಮಾಡಿದಾಗ
ಶೋಲ್ಡರಾ?
ಹೌದು ಸರ್, ಶೋಲ್ಡರ್.
ಓಕೆ. ಯಾವಾಗಿಂದ ಇದು?
ಸರ್, ನಾನು ಕ್ರಿಕೆಟ್ ಆಡಿದ್ರೆ ಮಾತ್ರ ಇದು ಫುಲ್ ಪೇನ್ ಇರುತ್ತೆ ಸರ್. ಅಂದ್ರೆ ಒಂದು 2 months ಇಂದ ಪೇನ್ ಇದೆ ಸರ್.
ಓಕೆ. ಏನಾದರೂ ಇಂಜುರಿ ಆಯ್ತಾ? ಜೋರಾಗಿ
ಏನು ಇಂಜುರಿ ಏನಾಗಿಲ್ಲ ಸರ್.
ಎಸ್ದಾಗ ಏನಾದರೂ ಸಡನ್ ಆಗಿ ಪೇನ್ ಬಂತಾ?
ಹೌದು ಸರ್, ಬಾಲ್ ಎಸ್ದಾಗ ಪೇನ್ ಬರುತ್ತೆ ಸರ್.
ಓಕೆ. ಸೊ ಯು ಆರ್ ಎ ಬೌಲರ್?
Yes, sir, bowler.
So you are a weekend warrior. Don't play in the
Yes, sir. ಇದರಿಂದ ಏನಾದರೂ ನಮಗೆ ಏನಾದರೂ
See, ನಿಮ್ಮ ಏಜ್ ಎಷ್ಟು?
ಸರ್ 32 ಸರ್.
32 ಸ್ಪೋರ್ಟ್ಸ್ಮೆನ್ ಥ್ರೋ ಮಾಡುವಾಗ ನೋವು ಬರ್ತಾ ಇದೆ ಅಂದರೆ ಮೇ ಬಿ ಸಮ್ ಇಂಜುರಿ ಹ್ಯಾಸ್ ಹ್ಯಾಪನ್ ಟು ಯುವರ್ ಶೋಲ್ಡರ್. ಪ್ರಾಬಬ್ಲಿ ವಿ ಕಾಲ್ ಗ್ಲಿನಾಯ್ಡ್ ಲೇಬ್ರಮ್ ಅಂತೀವಿ, ಆರ್ ಎ ರೊಟೇಟರ್ ಕಫ್. ಇಫ್ ಇಟ್ ಈಸ್ ಪರ್ಸಿಸ್ಟಿಂಗ್ ಈವನ್ ಆಫ್ಟರ್ 2 months, you should consult a doctor. There might be some injury to the muscles. Okay, rotator cuff muscles ಅಂತೀವಿ, ಅಥವಾ ಗ್ಲಿನಾಯ್ಡ್ ಲೇಬ್ರಮ್ ಅಂತ ಒಂದು ಕಾರ್ಟ್ಲೇಜ್ ಇರುತ್ತೆ ವಿಚ್ ಇಸ್ ಎ ಸಪೋರ್ಟಿಂಗ್ ಸ್ಟ್ರಕ್ಚರ್ ಫಾರ್ ಯುವರ್ ಶೋಲ್ಡರ್ ಜಾಯಿಂಟ್. ಅದೂ
ಸಂಡೇ ಫುಲ್ ಡೇ ಇರುತ್ತೆ ಸರ್, ಮತ್ತೆ ಮಂಡೇ ಆದ್ರೆ ಮತ್ತೆ ನಾರ್ಮಲ್. ಮತ್ತೆ ನಾನು ಯಾಕೆ ಥ್ರೋ ಮಾಡ್ತೀನಿ ಮತ್ತೆ ಸ್ಟಾರ್ಟ್.
ದಟ್ಸ್ ವಾಟ್, ಸಿ ಥ್ರೋ ಮಾಡಿದಾಗಲೇ ಅದು ದಟ್ ಸ್ಟ್ರಕ್ಚರ್ ವಿಲ್ ಕಮ್ ಇನ್ ಟು ಆ್ಯಕ್ಷನ್. ಓಕೆ. ಸಿ ಮೈನರ್ ಥಿಂಗ್ ಇದ್ದರೆ ಇಷ್ಟೊಳಗಡೆ ಸೆಟ್ಲ್ ಆಗಬೇಕಿತ್ತು. ಇನ್ನೂ ಪರ್ಸಿಸ್ಟ್ ಇದೆ ಅಂದರೆ ದೇರ್ ಈಸ್ ಸಮಥಿಂಗ್ ಮಚ್ ಮೋರ್ ಸೀರಿಯಸ್ ಪ್ರಾಬ್ಲಮ್. ಹಂಗೆ ನೆಗ್ಲೆಕ್ಟ್ ಮಾಡಬಾರ್ದು. ಏನಾಗುತ್ತೆ ಅಂದರೆ ಹಂಗೆ ಬಿಟ್ಟರೆ ಅದು ಪ್ರಾಬ್ಲಮ್ ದೊಡ್ಡದಾಗ್ಬಿಡುತ್ತೆ. ಅರ್ಥ ಆಗ್ತಾ ಇದೆಯಲ್ಲ? ಸ್ಮಾಲ್ ಟೇರ್ ಕ್ಯಾನ್ ಬಿಕಮ್ ಎ ಬಿಗ್ ಟೇರ್. ಓಕೆ, ದೆನ್ ಸರ್ಜರಿ ವಿಲ್ ಬಿ ದ ಆಪ್ಷನ್. ಅರ್ಥ ಆಯ್ತಲ್ವಾ? ಸೊ ಅದಕ್ಕೆ ಜಸ್ಟ್ ಮೀಟ್ ಎ ಡಾಕ್ಟರ್, ಸ್ವಲ್ಪ ಟೆಸ್ಟ್ ಎಲ್ಲ ಮಾಡಿ, ಎಕ್ಸಾಮಿನೇಷನ್ ಏನು ಸ್ಕ್ಯಾನಿಂಗು ಅದು ಇದು ಅದು ಆಮೇಲೆ ಫಸ್ಟ್ ಡಾಕ್ಟರ್ ನೋಡಿದ್ರೆ ಕರೆಕ್ಟಾಗಿ ಗೊತ್ತಾಗುತ್ತೆ. ಸಿ ದಿಸ್ ಆರ್ ಸಮ್ ಆಫ್ ದ ಥಿಂಗ್ಸ್ ವಿಚ್ ವಿ ಆರ್ ಥಿಂಕಿಂಗ್. ಒಂದು ರೊಟೇಟರ್ ಕಫು, ಇನ್ನೊಂದು ಎ ಕಾರ್ಟ್ಲೇಜ್ ಇಂಜುರಿ. ಸ್ಮಾಲ್ ಟೇರ್ಸ್ ಏನಾದರೂ ಇದ್ದರೆ ಈ ಥರ ಥ್ರೋಯಿಂಗ್ ಸ್ಪೋರ್ಟ್ಸಲ್ಲಿ ಇದು ವೆರಿ ಕಾಮನ್. ಅರ್ಥ ಆಯ್ತಲ್ಲ? ಥ್ರೋಯಿಂಗು, ಬೌಲಿಂಗು. ಸೊ ಮೇ ಬಿ ಇದೆಲ್ಲ ಏನಂದರೆ ಗುಡ್ ಫಿಸಿಕಲ್ ಆ್ಯಕ್ಟಿವ್ ಇರಲ್ಲ, ಓಲ್ ವೀಕ್ ತುಂಬ ಆ್ಯಕ್ಟಿವ್ ಆಗಿರ್ತೀರಾ, ಅಂದರೆ ಬ್ಯುಸಿ ಇರ್ತೀರಾ, ವಿತೌಟ್ ವಾರ್ಮ್ ಅಪ್, ವಿತೌಟ್ ಎನಿ ಫಿಸಿಕಲ್ ಫಿಟ್ನೆಸ್, ಯು ಗೋ ಡೂ ರಾಂಗ್ ಟೆಕ್ನಿಕ್ಸ್, ಆಗಿಬಿಡುತ್ತೆ ಈ ಥರ. ಓಕೆ, ಮೀಟ್ ಎ ಡಾಕ್ಟರ್ ಆ್ಯಂಡ್ ಗೆಟ್ ಟ್ರೀಟೆಡ್. ಓಕೆ,
Sure, sir. Thank you, sir.
ಓಕೆ.
Thank you. Thank you for answering the call, sir. So, like you said, the weekend warriors, sir. Any one word of advice you want to give them, sir, to prevent these kind of injuries?
See, again, I'll come back to exercise. See, yes, you want to be active, you want to play sports, you want to do everything what Sachin Tendulkar or Virat Kohli does, but for that, fitness is the main thing. You have to do not only, see, the problem is those who are all week you are sedentary. On a Sunday, you want to play sports with high intensity. There, the question of your muscles will not be conditioned. You are prone for muscular strains, tendinitis, some joint inflammation. All these things can happen. For that, better do some physical activity. You have WHO recommendation, 150 minutes of moderate physical activity. Some running, yes, for his aged 32 years, yes, he should do some activity. 30 minutes of moderate intensity physical activity, like running, jogging, a treadmill or elliptical. ಏನಾದರೂ ಒಂದು ಮಾಡಿದ್ರೆ you do something, your body will be, muscles will be conditioned so that the risk of injuries will be less. The problem is all week sedentary. Sunday they go and play very aggressively, high intensity. They are prone for injuries.
Thank you, sir. Now, coming back to our knee pain, knee arthritis, sir. So, now we finished about talking about the tablets and these injections now, sir. So, say a patient did not get relief with any of these. What should they do next?
Again, depends on the age, okay, and extent of involvement. An young patient, 40, 50 years, only a part of the knee is involved, only the inner side, medial compartment. We have 3 compartments in the knee joint: medial compartment, lateral compartment and patellofemoral. Only medial compartment, yes, there are options. Suppose if your knee is in varus, we do osteotomies. It's a joint preserving surgery. We don't replace. So, again, the misconception we should tell to the general public is not all surgeries are joint replacements. There are other options also. Okay, one is osteotomy is one of the things for a younger patient, where we can, the alignment can be changed to a normal. A bent knee can be made straight and the load distribution can be equalized so that the wear and tear doesn't progress. This is one of the things. Sometimes we do arthroscopic. We remove small loose bodies or osteophytes, bony outgrowths, shave off the cartilage, small meniscal tears, just we trim it off, smoothen it. So, some patients, see, the whole idea is to postpone the knee replacement. So, these are the some things which we do for younger patients. Long standing problem, not responding to any of this one in a younger patient. A old 50, 60 years, joint is fully damaged. Yes, when the activity is coming down, quality of life is coming down, patient should think about knee replacement.
Okay, sir. We just got a comment from one of our viewers, sir. Our viewer's name is Shri. She's a 28-year-old female. So, she's asking, the question is, can wearing high heels regularly affect our knees, hips or spine in the long term, sir?
Yes, definitely. The weight bearing load on the knee joint, it's going to affect. Yes, high heels is not for every day. Yes, occasionally they can use it, but if every day uses, it disturbs the alignments. Okay, so there is a chance the load on the spine, the load on the hip joints, even the ankle also. Patients get foot problems. Those who use high heel footwears, knees also they might get it. Okay.
Thank you, sir. Now, coming back to our discussion about the surgical aspect of it, you just really explained good things about something known as joint preservation surgery, sir. So, now let's get to the hot aspect of it. What is your views on total knee replacement? The advent of robotics is there now, sir. What is your take on it?
See, I've been doing knee replacement since 2005. We have been doing conventional. Yes, conventional has still got a role. For a simple, straightforward knee, conventional is still the best with an experienced hand. Robotics is coming. See, with the advanced technology, we cannot brush away robotics. people also want robotics. They come and ask, I want robotic. So robotics is coming in a big way. Robotics is, it's a very advanced technology where you can align the components very precisely. Accuracy is the main thing. You can sub-millimeter, okay? And also the soft tissue balance, what we conventionally, it is all surgeon experience, the feel and during surgery. But robotics will help us align the components accurately, what we want, and balance the soft tissues. These are the two common things which will determine the longevity of your surgery. How long the knee surgery will last. 15 years, 20 years. A well-aligned knee, a well-balanced knee will last 20 years, 25 years with the modern implants. Robotics comes in a big way. And one more thing is robotics helps is in complex cases. A patient had a old fracture, it is deformed, a obese patient, 120, 130 kilos, a severe varus deformity, severe bowlegs, valgus deformity, recurvatum. In any complex deformities, robotics is the best option than the conventional. For a straightforward, if you ask me, yes, conventional and robotics is okay, but for advanced, robotics is this one. We are very thankful to our chairperson, madam, Dr. D.A. Kalpaja. We have got one of the best robotic platforms in Vydehi, which has been recently introduced. The whole idea of bringing robotics of our chairperson, madam, is to offer it to even the needy people, even the poor people who come to our hospitals, along with the people who are affordable also. See, this is one of the state-of-the-art robotic arm assisted surgery from Mako, USA. I think we are very grateful to our chairperson and also the management.
Thank you for that valuable information, sir. So we'll just take a small break and we'll join our users live again, sir.
Yeah.
Thank you.
Thank you.
Years of healing hearts, saving lives, and serving communities. And now, as we celebrate this milestone, Vydehi Hospital, Whitefield, Bengaluru brings you something truly special. Because quality healthcare should be accessible to everyone, not just a few. Introducing high-quality surgical care at remarkably affordable costs. Surgeries priced to match government scheme tariffs, with eligibility extended to all patients. From general surgery and orthopedics to ENT, oncology, neurosurgery, urology, and more, all under one roof. Celebrating 25 years of excellence and a lifetime of care.
Most frequent causes of leg and back symptoms is a herniated disc. Here, high forces can cause the outer fibrous ring to rupture and the fibers and core material to exit into the spinal canal. First, a guide wire is used to ensure the correct positioning of the instruments. Thanks to special instruments and devices such as the dilator and working sleeve, this procedure offers the most minimally invasive approach compared with conventional methods. An essential component is the endoscope, which guarantees optical control of the treatment at all times. This allows the procedure to be performed safely and least invasive.
Good morning, everyone. Thank you for joining us again after a really short break. I'm Dr. Nishant, your host, and today with us we have Dr. Hiranya Kumar. So now let's get back to the discussion, sir. So now we spoke about our robotic knee replacement, sir. A very common doubt that everyone has: does the robot do the surgery or does the surgeon do the surgery?
Yeah, for me also many of the patients come and ask that same thing. Very frequently they ask the same question. See, it is a robotic arm assisted surgery. Here the surgeon is the one who performs everything. Robot will assist him. Okay. See, it's like an advanced GPS with a power tool. Understand? So surgeon will plan, surgeon will also execute, but the robot sees that you will not cross the borders. Okay. You'll see that you won't resect extra bone, you won't damage the soft tissues, vessels, ligaments. It sees that you are in the boundary. It's like a lane assist. When you are driving a car, it will see that you are not crossing the boundary. Mm-hmm. It keeps you perfect. Not, I told, a sub-millimeter, less than 0.5 or 1 degree angulation. This is the whole advantage of the robot. It is a robotic assisted surgery. It's not the robot. It's a surgeon who does everything. Even the drill saw, the robot surgeon will does everything. When he stops, the robot stops. But the robot is when the surgeon goes beyond that uncomfortable zone, the robot stops. The drill stops. The burr stops. It will not move. It comes to complete stops. So that is the beauty. Whereas in conventional, yes, sometimes we take out extra bone, sometimes angulation comes, all these things. This is the advantage of a robot.
Thank you so much, sir. So now we got a small comment from one of our users who has a doubt. Okay. So his name is Mr. Deepak. So he's asking, hi doctor, can I get neck pain and shoulder pain after working on my laptop? And could posture be the reason for the same?
Yes. People working 6 hours, 8 hours, neck pain, tech neck, what we see in all the techies, it is also called as tech neck, sitting for long hours with the neck stooped forward. You are disturbing the whole alignment of your spine, the muscles, they get stretched or elongated, some will become slack, the curvatures of your spine is getting disturbed. Definitely day in and day out, if you do same thing, muscles will definitely have some micro injuries, micro traumas, the neck pain can become constant. So here ergonomics will come. How you sit, what chair you use, what position you do. So people who are this, I think any techie who is working, you would have all gone through this. They will be knowing what to do. Yes, we have what is known as 20-20 rule for a neck pain, how to prevent this. Every 20 minutes, you have to sit for 20 seconds, 20 feet far away. You are doing all these things, lift up your neck, 20 feet you see for 20 seconds. This is one way you have to keep it up so that your neck is in good condition. Okay, so similarly, yes, people who are working for a long time, you should get up, move around. It is mainly to improve your circulation to your muscles, for the discs, because they have been put under a lot of stress in abnormal positions. Okay, yeah.
Thank you, sir. We have another question from the audience. So it's from Mr. Ramkaran. He asked, do the clips or anchors used in meniscus surgery, they have a lifespan, or are they meant to remain permanently, or do they have to be removed?
Yes, meniscus, It's one of the commonest injuries in younger people. We use what is known as non-absorbable stitches to repair. See, earlier we used to do all meniscectomy, all these things. Now we try to conserve meniscus. Meniscus is very important for the knee joint. When we use, there is called as all inside and inside out. Okay, so it's a non-absorbable stitches. There are small, this one, what is a bioabsorbable clips. It would have got resorbed by this time. So usually after 6 months, 1 year, it gets resorbed. But the stitch, the material is usually a non-absorbable stitch that will persist for it doesn't cause any harm or doesn't come in the function of this one. So we very rarely remove this. We don't remove at all. As far as the suture material, it stays there inside the body of the meniscus. There are some clips which are used in all inside, which will be on the back side of the meniscus. They would have got absorbed. It is usually an absorbable, this one. It would have got absorbed in the body.
Thank you, sir. So we have another question from the user, sir. So he's asking now, you said about neck pain and back pain, and he's telling what is neck pain, what is back pain, and what is the slip disc?
See, the commonest cause for neck pain, back pain, it's all like we discussed, it is the posture, day-to-day postures, abnormal postures, sitting for long hours. It's a mechanical pain. Once you change that, follow good ergonomics, usually these sort of things will go. A slip disc is a much bigger problem. Slip disc, usually it can happen in the neck, it can happen in the low back, because they are the one which takes the more load. Slip disc, usually a minor slip disc, it's only a small bulges will be there. A much bigger disc prolapse which comes out of the thicker annular this one tissue, a soft jelly material will come out and presses on the nerve root. Patient will start getting pain traveling all the way up to the foot, all the way up to your fingers.
Okay.
This is what is slip disc.
Okay, sir. So we have another question from Mr. Vamshi. He's asking is, can a slip disc heal on its own?
Slip disc, yes. See, that's why we don't. So this again, the misconception with the public is slip disc surgery. Slip disc surgery.
Yes, sir.
We have seen that sometimes even very big disc, massive disc prolapse, they regress, they shrink by itself. So usually 3 months, 6 months, we wait. Many of the patients starts getting relief. The people who don't get relief, it is worsening. The problem is persisting even after 6 months, affecting their professional life. Then there are various options like an injection, selective nerve root injections, or surgeries. Very advanced surgeries are there. Nowadays, we have microscope discectomies, endoscopic discectomies, or even conventional. So there are various other options we can offer to the patients.
Okay, sir. Thank you, sir. So you mentioned about something known as endoscope, sir. For a person who's generally there, they're not aware about this one that can be done in the spine. Most of the general public have heard endoscope in the abdomen and etc. Sir, can you just help us understand what is this endoscopic spine surgery, sir?
See, again, as I told, the disc which doesn't respond, disc issues.
Yes, sir. We're getting another call. Let's answer it. Hello.
Yes, Madhushri.
Hi, sir. Good morning.
Good morning.
Sir, I'm calling from Pension Tree.
Yeah, please tell me.
I have joined the gym recently after many years, and also had an daily exercise also. So I started doing squats, and now I'm facing knee pain, clicking sound is coming. So I'm thinking, is there any major pain? And also I'm not facing any major pain also, but I'm scared is there any damage is there? Otherwise, should I stop for exercise? What
Okay. So she's asking about the same thing like one of our weekend warriors question. So she's also been working out in the knee and now she's having a knee clicking sound, sir.
Okay.
So how do we go
Okay.
ahead about it?
Madhushri, yes, I understood your question. You're telling you're getting a click sound. Are you getting any pain, swelling, any difficulty in walking?
Like lightly on one day, on that day I'm getting less pain. After that, I didn't feel anything pain after that one day.
See, occasional click sound or crackling without.
Yeah, when I done the exercise, on that day, like a immediate clicking sound it will come.
See, if it is not associated with pain, swelling, or difficulty in walking, or any locking, it is normal. See, many of us will have some click sound, mainly because some gas bubbles released in the synovial fluid. Sometimes a tendon slips over the bone. So this is very common. But you should, if you're having pain, swelling, difficulty in walking, yes, you should meet a doctor. There could be so many causes for clicking sound if it is associated with symptoms. So if it's an occasional not having any symptoms, you need not worry. You should, for your age. Okay. Okay. Hello.
Hello.
Am I clear? Did you understand?
Yes, sir. Quite glitching, sir. Hello.
Okay.
Okay. Thank you, Madhushri. Thank you. So that's what, sir. A lot of people have this concept and misconception.
No, if they are associated with symptoms, yes, it's a much bigger problem. It has to be evaluated. It could be a meniscal issue, or it could be some chondromalacia patella, some clicking, or even osteoarthritis. Also, sometimes we get some ligament injuries. So it should be evaluated with a doctor.
Okay, thank you, sir. So we have another question from our viewers. He's a 76-year-old male. So, Mr. Devraj, he's asking what kind of supplements do I need to take for my bones to stay strong at this age? He is a CKD patient. So, he's a 76-year-old CKD patient. So, what supplements can he take to strengthen his bones?
See, 76 years, the first thing he should do is get an DEXA scan.
Okay, sir.
So, he's a very high risk for osteoporosis. See, all of the common public believes osteoporosis, calcium. If I take calcium, my bones are strong. No, that's not the case. Calcium is not equal to treatment of osteoporosis. So, for his age, he has to be assessed with DEXA scan. We use FRAX tool, fracture risk assessment tool, to know how much risk he is having for a fracture. If he has a trivial fall, what is the risk? Depending on this assessment, clinical scanning, DEXA scanning, FRAX tool, any previous injuries, previous fractures, whether he's on steroids, all these things we can come to know that what is this fracture, major fracture risk or spine fracture risk. Once we come to know that, we can start on specific treatment for osteoporosis. Yes, for osteoporosis, calcium, vitamin D, protein, these are the main foundation, but the exact treatment is different. There are various injections. It can be decided only after finding out this. Definitely for his age, anybody male more than 70 years and especially CKD definitely is a candidate for osteoporosis treatment. He has to be evaluated and started pharmacological treatment for osteoporosis. We have very good advanced treatment depending upon his risk, whether it's a low risk, high risk or eminent risk, very high risk. Then we can treat him accordingly, whether he requires an injectable or a oral tablets, which might have to be continued for 4 to 5 years.
Okay, sir. So that's what we have another question from the user, sir. So you mentioned something about a DEXA or a BMD, sir. Can you just tell us what it actually is?
See, DEXA is dual energy absorption this one test. Here we test the density of the bone. Density of the bone. See, bone is a living tissue. It forms, again rebuilds. It's a living tissue, new bone forms, again loss of bone will be there, again new bone forms. It keeps on happening. After 50, 55, postmenopausal in females, after 70 in males, that rebuilding capacity comes down. So there will be accelerated loss of bone, especially in females. So the bone density reduces. So this DEXA scan finds out what is the status. We use this test, it will tell you the T-score which is commonly used. If it is more than -2.5, we put it as osteoporosis. -1 to 2.5 is osteopenia. It is a less severe extent. See, nowadays the modern concept of osteoporosis is not just DEXA scan. We see the clinical factors, what are the risk factors they have got, what are the secondary causes for osteoporosis, steroid treatment, old fractures, parents fractures itself is a risk factors, age, postmenopausal. So we take all these things, we come to what is the risk for the patient. Then we classify into low risk, very high risk and eminent risk. So those who are very high risk, we have to start with injectables. Very low risk, we start with some just only calcium, some physical activity. Okay. Yeah. The whole idea is the treatment of osteoporosis is to prevent fractures, and it's a very silent disease. Many of them present as a fracture for the first time. They will tell, once we tell them you have osteoporosis, doctor nanu gotte irlilla osteoporosis ide anta. They would have fractured their hip bone, spine, wrist, they come to the casualty. When we tell that your bones are very weak, I was not knowing, because they don't get tested. Again, here also the exercise is the main thing. Load bearing exercises, some gentle strengthening exercises, balance training, functional training. Many of the patients, they have falls because their muscles are not strong enough. They have slipped in the bathroom, trivial falls, fracture. So this is where we have to concentrate on, especially elderly people. Gentle exercises, balance training are very, very important. Along with that, there are many pharmacological treatments.
Okay, sir. So we have another question from one of our viewers, sir. So he's asking, his name is Ritik, he's asking, doctor, with robotic surgery or operating advanced robotic machines to perform the procedure, some patients may feel that a manually performed surgery is more careful because a surgeon is directly handling everything. From your experience, how would you compare robotic surgery with conventional surgery, and what would you say to patients that have this concern, like how you were mentioning earlier?
Yes.
About the same?
See, we have what is known as semi-active and active robots still there in the market. The most globally accepted and widely adopted is the semi-active. In an autonomous robot, the robot does everything. Surgeon will just only assist. In a semi-active, surgeon does everything. Robot will keep you. So there is risk of injuries to the ligaments, the vessels are all very, very less. As far as I am concerned, as I've already told that, it's a very advanced technology. Accuracy, alignment accuracy is very good with robotic. Soft tissue balance is very good. The idea is to prevent long-term complications. Yeah, when patients are affordable, a right patient, a right indication, robotics would be the best option I can offer to the right patient.
Okay. Thank you, sir. So we'll just take a small break, sir, and we'll join live again, sir, after the small break. Thank you, sir.
Years of healing hearts, saving lives, and serving communities. And now, as we celebrate this milestone, Vydehi Hospital, Whitefield, Bengaluru brings you something truly special. Because quality healthcare should be accessible to everyone, not just a few. Introducing high-quality surgical care at remarkably affordable costs. Surgeries priced to match government scheme tariffs, with eligibility extended to all patients. From general surgery and orthopedics to ENT, oncology, neurosurgery, urology, and more, all under one roof. Celebrating 25 years of excellence and a lifetime of care.
One of the most frequent causes of leg and back symptoms is a herniated disc. Here, high forces can cause the outer fibrous ring to rupture and the fibers and core material to exit into the spinal canal. First, a guide wire is used to ensure the correct positioning of the instruments. Thanks to special instruments and devices such as the dilator and working sleeve, this procedure offers the most minimally invasive approach compared with conventional methods. An essential component is the endoscope, which guarantees optical control of the treatment at all times. This allows the procedure to be performed safely and easily.
Hello? 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 ನಮಸ್ತೆ ಸರ್, ಹೇಳಿ ಸರ್, ಕೇಳಿಸ್ತಿದೆಯಾ?
ಮಾಲೂರಿಂದ ಮಾತಾಡ್ತೇನೆ, ಕೋಲಾರ ಡಿಸ್ಟ್ರಿಕ್ಟ್ ಮಾಲೂರಿಂದ ಶಾಂತಮೂರ್ತಿ ಅಂತ ಹೇಳಿ.
ಹೇಳಿ ಸರ್.
ನನಗೆ ವೈದ್ಯರಲ್ಲಿ ಮೂರು ಡಾಕ್ಟರ್, ಜೂನಿಯರ್ ಡಾಕ್ಟರ್ ನಿಮ್ ನಂಬರ್ ಕೊಟ್ರು. ಇವತ್ತು ಫೋನ್ ಕಾಲಲ್ಲಿ ಸಿಗ್ತಾರೆ, ಮಾತಾಡಿ ಆರ್ಥೋಪೆಡಿಕ್ ಅಂತ.
ಹೇಳಿ ಸರ್.
ಹೇಳಿ.
ನನಗೆ ಬ್ಯಾಕ್ ಪೇನ್, ಅಂದ್ರೆ ಸೊಂಟದ ನರ ತುಂಬಾ ಮೂಳೆ ನೋವು ಬರುತ್ತೆ ಸರ್. ಅದಕ್ಕೆ ಕೇಳಿದೆ. ಅವರು ಇವತ್ತು ನಿಮ್ ಕಾಂಟ್ಯಾಕ್ಟ್ ಮಾಡಿ ಅಂತ ಹೇಳಿದ್ರು.
ಯಾವಾಗ, ಎಷ್ಟು ವಯಸ್ಸು ನಿಮ್ದು? ಎಷ್ಟು ವಯಸ್ಸು?
63 ಸರ್.
ಸೊಂಟದಲ್ಲಿದೆಯಾ? ನೋವು ಎಲ್ಲಿದೆ ನಿಮ್ಗೆ?
ಸರ್ ಈ ಹಿಂದೆ ಬ್ಯಾಕ್ ಬೋನ್ ಇದೆಯಲ್ಲ ಸರ್, ಅದು ಸರಿಯಾಗಿ ಜಾಯಿಂಟ್ ಅಲ್ಲಿ ನೋವು ಬರುತ್ತೆ ಸರ್.
ಓಕೆ.
ಸೊಂಟ
ಬರೀ ಅಲ್ಲೇ ಇದೆಯಾ? ಕಾಲ್ಗೂ ಅರಿಯತ್ತಾ?
ಕಾಲು ಇದೆ ಸರ್, ಕಾಲು ಕಂಪ್ಲೀಟ್, ಎಡಗಲ್ಲಿ ಕಂಪ್ಲೀಟ್ ನೋವು ಬರುತ್ತೆ ಸರ್.
ಚಳುಕು ಜೋಮು ಆ ಥರ ಎಲ್ಲ ಬರುತ್ತಾ ಕಾಲಲ್ಲಿ?
ಹೌದು ಸರ್, ಬರುತ್ತೆ ಸರ್.
ಯಾವಾಗಿಂದ ಇದೆ ಇದು?
ಸರ್ ಇದು ಹೆಚ್ಚು ಕಮ್ಮಿ ಡಿಸೆಂಬರ್ ಇಂದ ಇದೆ ಸರ್.
ನಡೆದ್ರೆ ಜಾಸ್ತಿ ಆಗತ್ತಾ ಇದು?
ಹೌದು ಸರ್, ನಡೆದ್ರೆ ಮುದಿಯಲ್ಲಿ ಹಿಂಪಲ್ಲಿ ಒಂಥರ ಗಡ್ಡೆ ಕಡ್ದಂಗ ಆಗುತ್ತೆ ಸರ್. ನಡೆಯಕ್ಕಾಗಲ್ಲ, ನಿಧಾನಕ್ಕೆ ನಡೆದ್ರು ಹೆಜ್ಜೆ ಇಕ್ಕಿದ ತಕ್ಷಣನೇ ನೋವು ಜಾಸ್ತಿ ಆಗುತ್ತೆ, ಊದ್ಕೊಂಡಂಗ ಆಗುತ್ತೆ ಸರ್.
ಅದೇ ಇದು ಏನಂದ್ರೆ ಏಜ್ ರಿಲೇಟೆಡ್ ಚೇಂಜಸ್ಸು ಸ್ಪೈನಲ್ಲಲ್ಲಿ ನರಗಳು ಟೈಟ್ ಆಗೋಗಿದೆ. ಅಲ್ಲಿ ವಿ ಕಾಲ್ ಸ್ಪೈನಲ್ ಕೆನಾಲ್ ಸ್ಟಿನೋಸಿಸ್ ಅಂತೀವಿ. ಸ್ವಲ್ಪ ನರದ ಪ್ರಾಬ್ಲಮ್ ಇದೆ ಸೊಂಟದಲ್ಲಿ. ಇದನ್ನೆಲ್ಲ ಟೆಸ್ಟ್ ಮಾಡಬೇಕು, ಎಕ್ಸ್ರೇ ಎಲ್ಲ ಮಾಡಬೇಕು, MRIನೂ ಬೇಕಾದರೆ ಮಾಡಿಸ್ಬೇಕು. ಬನ್ನಿ ವೈದ್ಯರಿಗೆ ಬನ್ನಿ ಮಾಡೋಣ. ಫಸ್ಟು
ಮಾಡಿಸಿದ್ದೆ ಸರ್, MRI ಮಾಡಿಸಿದ್ದೀನಿ.
ಹಾಂ
ಅದು ಈ ಫಸ್ಟ್ ನಂಬರ್ ಇದೆ ಅಂತಲ್ಲ ಸರ್, ಅದು ಸ್ವಲ್ಪ
L4 L5
ಹೌದು ಸರ್, ಅದು ಕೆಳಗಡೆ ಫಸ್ಟ್ ಸ್ವಲ್ಪ ಹೊರಗಡೆ ಬಂದ್ಬಿಟ್ಟಿದೆ, ಅದಕ್ಕೆ ನಾವು
ಹೌದೌದು
ಆಪರೇಷನ್ ಮಾಡಬೇಕು ಅಂತ ಹೇಳಿದ್ರು.
ಅದೇ ಡಿಸ್ಕ್ ಪ್ರಾಬ್ಲಮ್ ಇದೆ, ಡಿಜೆನರೇಟಿವ್ ಡಿಸ್ಕ್ ಪ್ರಾಬ್ಲಮ್ ಅಂತೀವಿ. ವಯಸ್ಸಾಗ್ತಾ ಅದು ಡಿಸ್ಕಲ್ಲಿ ವಾಟರ್ ಕಂಟೆಂಟ್ ಕಮ್ಮಿ ಆಗಿಬಿಟ್ಟು ಡಿಸ್ಕ್ ಹೊರಗಡೆ ಬಂದುಬಿಡುತ್ತೆ. ಅದು ಬಂದು ನರದ ಮೇಲೆ ಕೂತ್ಕೊಳ್ಳುತ್ತೆ. ಪ್ಲಸ್ ಸ್ವಲ್ಪ ಮೂಳೆಗಳೆಲ್ಲ ಸೌದು ಅದು ಸ್ಪೈನಲ್ ಕೆನಾಲು ಸ್ವಲ್ಪ ನ್ಯಾರೋ ಆಗಿಬಿಡುತ್ತೆ. ಅದಕ್ಕೆ ಬನ್ನಿ, ನೀವು ತಗೊಂಡು ಬನ್ನಿ, ಅದನ್ನು ನೋಡಿಬಿಟ್ಟು ವಿಲ್ ಸಿ ಏನು ಮಾಡಬೇಕೋ ನೋಡೋಣ. ಬರೀ ಇಂಜೆಕ್ಷನ್ನು, ಟ್ಯಾಬ್ಲೆಟು, ಫಿಸಿಯೋಥೆರಪಿಯಲ್ಲಿ ಆಗುತ್ತಾ ಇಲ್ಲ ಸರ್ಜರಿ ಮಾಡಬೇಕಾ? ಇದನ್ನು ನಿಮ್ಮನ್ನು ಎಕ್ಸಾಮಿನ್ ಮಾಡಿದೆ, MRI ನೋಡಿದೆ ನಾವು 100% ಹೇಳೋಕ್ಕಾಗಲ್ಲ. ಬಟ್ ನಿಮ್ಮ ಪ್ರಾಬ್ಲಮ್ ನೋಡಿದ್ರೆ ಅಲ್ಲಿ ನರ್ವ್ ಕಂಪ್ರೆಷನ್ ಇದೆ, ಅದನ್ನು ನೀವು ಬಂದರೆ ನಾವು ನಿಮ್ಮನ್ನು ಎಕ್ಸಾಮಿನ್ ಮಾಡಿ ಏನು ಮಾಡಬೇಕೋ ಮಾಡಿಕೊಡ್ತೀವಿ. ಬನ್ನಿ ಸೋಮವಾರ ಬನ್ನಿ, ದಿನ ಸಿಗ್ತೀನಿ, ಬನ್ನಿ, ನೋ ಪ್ರಾಬ್ಲಮ್. ಬನ್ನಿ, ಪರವಾಗಿಲ್ಲ, ಬನ್ನಿ, ಇರ್ತೀನಿ. 9 to 4 ಬನ್ನಿ. ಓಕೆ. ಹಿರಣ್ಯ ಕುಮಾರ್ ಅಂತ. ಓಕೆ.
Thank you. Sir. So now we got an enlightenment question from him, sir.
Yeah.
So you're saying that he might require surgery, sir.
Yeah.
So could his surgery be done in this endoscopic way, sir? Could you just explain about our endoscopic
Yes,
spine surgery?
endoscopy spine surgery, full endoscopic spine surgery is a possibility. We have to see his MRI. Not all discs are option for endoscopy. A selective, a right patient. Yes, in this case is a 63 years, lot of degenerative changes will be there. Along with the disc, there might be canal stenosis also. The space for the nerve is very narrowed, so it is getting compressed. Along with the canal, also the nerve root has been compressed. Endoscopic spine surgery is an option for him. Open surgery is an option for him. Microdiscectomy is an option. Maybe if there is an instability, we have to stabilize and fuse the spine also. Whatever I feel he is suffering a lot, it requires further evaluation. Once we see MRI, we can tell properly.
Okay, sir. And how common is the endoscopic spine surgery in our hospital, sir?
See, again, as I told about robotic, endoscopic surgery, the endoscopic equipment is one of the first medical college in Bangalore to get endoscopy. Again, we are very thankful for madam to giving all the advanced technology to our patients. Endoscopic spine we are having since almost 2 years. We are doing a lot of cases. Along with robotics, endoscopy is also one of the advanced, this one. It is becoming into the mainstream treatment. People are all adopting. In the next 5 years, I think the minimally invasive technique in that endoscopy will become one of the main for spine surgeries.
Okay, sir. So now we got our caller from Malur. So he's coming from somewhere away from Bangalore, sir. So are there any special schemes or offers for going around right now in our hospital to help the people?
See, Vydehi is completing 25 years. We are celebrating 25 years. Since beginning of January, we are offering very nominal rates, government tariff rates, Ayushman Bharat rates, PMJY rates to all surgeries for joint replacement, hip and knee, spine surgeries, arthroscopic surgeries, fractured traumas. We are giving very, very nominal this one. So he will be a very ideal candidate. We can definitely offer to him our silver jubilee package. Again, we are grateful for our management to giving this to our patients who are getting benefited. In orthopedic itself, we have operated more than 1,000 surgeries in Silver Jubilee scheme since January. More than 1,000 major surgeries under Silver Jubilee scheme, government tariff rates for our local population.
Okay. Thank you so much, sir. So we have a few questions, sir. So the first question from one of our user is, name is Ms. Anisha Ramkaran. So her daughter sprained her ankle and she went to a doctor and they said that there's no fracture in the x-ray, but she's still having swelling after 2 weeks. So what should she do?
See, most of them, this for an young girl, usually it will be a grade 1 or grade 2 sprains, partial tears, or maybe a stretch of ligaments. Usually it should settle down. Just icing, a crepe bandage, limited activities, avoid any sports or this one. For 2 weeks, I think she can wait. Usually they all settle down. Yes, if it persists bothering her, maybe we have to evaluate further.
Okay, sir. So we have another question, sir. So the person is asking whether you could advise if he needs any further management, physiotherapy or a follow-up examination. So he's a person who had one arm facing mild pain. When I'm doing running, especially knee joint and ankle joint, completely there's no pain. Only near the shin area, he's feeling more pain. So he's asking if what could be the issue and if there's any further requirement.
He's a runner?
Yes, sir. He's a runner. So he runs. He's only facing mild pain while running and only in the shin area. Everything else is fine.
See, this we call shin splints. Okay, this is very common in runners, especially those who have started recently, those who are running long distance. They'll start developing micro injuries into the in the shin, lower part of the tibia bone. So there might be we call even a micro fractures. X-rays it will not show. There will be a small break in the trabeculae or something. Usually they settle down. Maybe this is all because of they are not accustomed to this much of running. They are with the enthusiasm, they are running so much. They will have a so usually they settle down. They need not stop any this one. Keep on doing. Yes, if there is a swelling, if every step it is very painful, difficulty to walk, if it becomes persistent, yes, it has to be evaluated. Most of the time these shin splints usually goes away. Okay, they should not discontinue running. Yes, maybe slow down, not discontinue.
Okay, sir. Thank you, sir. We have another question from Mr. Bunny. So he says, "Hi doctor, recently my dad had a shoulder dislocation and underwent treatment for the same. He took around 1 month of rest, but he's still experiencing pain while lifting his hand and during physical activities. So what should he do next?"
What is his age?
His age is around 70 years.
70 years, shoulder dislocation 1 month has been reduced, started physiotherapy, you should continue physiotherapy right now. So usually we don't advise surgery for shoulder dislocation for a 70 years old. If it becomes a recurrent problem, his shoulder joint recurrently pops out, then surgery is an option. Right now physiotherapy, under a good physiotherapist, strengthen his shoulder muscles, take care, have some precautions, overhead activities he should avoid. Usually by 3 months he should recover.
Okay, sir. So now let's discuss a little bit about his age. Now he's around 70 years of age, sir. So now this osteoporosis you're saying is mostly like in elderly. Can people below the age of 50 years or 40 years also suffer from osteoporosis?
Yes, those who, we call this secondary osteoporosis, those who are on steroids. Steroids are commonly used for rheumatoid arthritis, patients who are on rheumatoid steroid, this one, hypothyroidism, diabetes. Yes, there are instances where lesser people, obesity, sedentary lifestyle, they can all have osteoporosis even less than 50, 55, 60 years also. So if there are risk factors, they should be subjected to DEXA scan, assess them to using the FRAX tool. Accordingly, we can plan their management.
Okay, so thank you, sir. Now there's a common myth saying that only women suffer from osteoporosis. But can men also suffer from osteoporosis?
Yes. See, again, yes, as you told, it's a myth. It happens only in postmenopausal women. Men will not have. No, that is, even men over 70 years, they can have osteoporosis. See, the accelerated bone loss, as I told previously, that happens in postmenopausal women because of the hormonal changes, the deficiency of estrogen. Similarly, after 70 years,
Yes, sir.
testosterone.
One
Yeah.
second, we're just getting another call, sir, from 150. Let's just answer it. Hello.
ಹಲೋ ಸರ್, ನಮಸ್ತೆ.
ನಮಸ್ತೆ ಮೇಡಮ್, ಹೇಳಿ.
ಸರ್, ನಾವಿಲ್ಲಿ ಬೋರ್ಡಿಂದ ಕಾಲ್ ಮಾಡ್ತಾ ಇರೋದು.
ಎಲ್ಲಿಂದ ಮೇಡಮ್?
ಸಿಲ್ಕ್ ಬೋರ್ಡ್.
ಹಾಂ,
ಹೌದು
ಹೇಳಿ.
ಸರ್, ಪ್ರಾಬ್ಲಮ್ ಇದೆ. ಸೊ ಏನಂತ ಅಂದ್ರೆ, ಲೈಕ್ ಆಲ್ಮೋಸ್ಟ್ ನಿಮ್ಗೆ ಬ್ಯಾಕ್ ಪೇನ್ ಸಿವಿಯರ್ ಆಗಿ ಬರ್ತಾ ಇರುತ್ತೆ. ಸೊ ಬ್ಯಾಕ್ ಪೇನ್ ಬರೋದ್ರಿಂದ ನಾರ್ಮಲ್ ಪೇನ್ ಕಿಲ್ಲರ್ಸ್ ಎಲ್ಲ ತಗೋತಾ ಇರ್ತೀನಿ. ಸೊ ಪೇನ್ ಕಿಲ್ಲರ್ಸ್ ತಗೊಂಡಾಗ ಒನ್ ಡೇ ಅಷ್ಟರಲ್ಲಿ ಓಕೆ ನಾರ್ಮಲ್ ಆಗಿರ್ತೀವಿ. ಬಟ್ ಆಲ್ಮೋಸ್ಟ್ ಈ ತರ ಪೇನ್ ಬಂದಾಗೆಲ್ಲ, ಬ್ಯಾಕ್ ಪೇನ್ ಬಂದಾಗೆಲ್ಲ ಯಾವಾಗ್ಲೂ ಈ ತರ ಟ್ಯಾಬ್ಲೆಟ್ಸ್ ತಗೋತಾನೆ ಇರ್ಬೇಕಾಗುತ್ತೆ. ಸೊ ಅದರಲ್ಲಿ ಟ್ಯಾಬ್ಲೆಟ್ಸ್ ನ ಕಂಟಿನ್ಯೂ ಮಾಡೋದಾ ಅಥವಾ ಏನಾದ್ರು ತೋರಿಸದ ಹಾಸ್ಪಿಟಲ್ ಈ ತರ?
ನೋಡಿಮ್ಮ, ಇದು ಯಾವಾಗಿಂದ ಇದೆ ಈ ಪ್ರಾಬ್ಲಮ್ ನಿಮಗೆ?
ಈಗ ಒಂದು 2-3 months ಇಂದ ಬರುತ್ತೆ. ನಾರ್ಮಲ್ ಬ್ಯಾಕ್ ಪೇನ್ ಹಂಗಿರುತ್ತೆ. ಸೊ ಟ್ಯಾಬ್ಲೆಟ್ಸ್ ತಗೊಂಡ್ರೆ ಕಂಫರ್ಟಬಲ್ ಇದಿರುತ್ತೆ. ಸೊ ನೆಕ್ಸ್ಟ್ ಬರಲ್ಲ. ಇಫ್ ಇನ್ಕೇಸ್ ಇನ್ನೊಂದು ವೀಕ್ ತಿರ್ಗಾ ಅದೇ ತರ ಸೇಮ್ ಇಶ್ಯೂ ಆಗ್ತಾರೆ, ರಿಲೀಫ್ ಆಗ್ಬಿಡುತ್ತೆ ಪೇನ್ ಕಿಲ್ಲರ್ಸ್ ಏನಾದ್ರು ತಗೋಕೆ.
ನೋಡಿಮ್ಮ, ತುಂಬಾ ದಿವಸ
ಈ ತರ ಪೇನ್ ಫೇಸ್ ಮಾಡ್ತಾ ಇದ್ದೆ.
ಇಲ್ಲ, ಈ ಥರ ಪದೇ ಪದೇ ಬರ್ತಾ ಇದೆ ಅಂದರೆ ಯು ಶುಡ್ ನಾಟ್ ನೆಗ್ಲೆಕ್ಟ್. ಓಕೆ, ಸಿ, ಪೇನ್ ಕಿಲ್ಲರ್ ತಗೊಂಡೋದ್ರಿಂದ ಯು ಆರ್ ನಾಟ್ ಸಾಲ್ವಿಂಗ್ ದ ಪ್ರಾಬ್ಲಮ್. ಯು ಫಸ್ಟು ಏನರಿಂದ ಬರ್ತಾ ಇದೆ ಅಂತ ಕಂಡುಹಿಡಿಬೇಕು. ಯು ಶುಡ್ ಮೀಟ್ ಎ ಡಾಕ್ಟರ್. ಸಿ, ಸಮ್ಟೈಮ್ಸ್ ನೆಗ್ಲೆಕ್ಟ್ ಮಾಡಿ ಸಡನ್ನಾಗಿ ಯು ಮೈಟ್ ಫೈಂಡ್ ಔಟ್ ಎ ಬಿಗ್ಗರ್ ಪ್ರಾಬ್ಲಮ್. ಸೊ ಎಸ್, ಫಸ್ಟಲ್ಲಿ ಪೇನ್ ಕಿಲ್ಲರ್ ತೊಗೊಬೇಕು, ಒಂದ್ಸಲಿನೋ 2 ಸಲಿನೋ. ಬಟ್ ಪದೇ ಪದೇ ಈ ಥರ ಬರ್ತಾ ಇದೆ ಅಂದರೆ ಏನೋ ಪ್ರಾಬ್ಲಮ್ ಇದೆ, ಅದರಿಂದನೇ ಬರ್ತಾ ಇರುತ್ತೆ. ಅರ್ಥ ಆಯ್ತಲ್ವಾ? ಸೊ ಅದರಿಂದ ನೆಗ್ಲೆಕ್ಟ್ ಮಾಡಬಾರ್ದು. ಜಸ್ಟ್ ಗೆಟ್ ಎ ಕನ್ಸಲ್ಟೇಷನ್, ಡಾಕ್ಟರ್ ಹತ್ರ ಚೆಕಪ್ ಮಾಡಿಸಿ. ಮೋಸ್ಟ್ ಪ್ರಾಬಬ್ಲಿ ನಥಿಂಗ್ ಮೇಜರ್, ಬಟ್ ಯು ಶುಡ್ ನಾಟ್ ನೆಗ್ಲೆಕ್ಟ್. ಓಕೆ, ದಿಸ್ ನೀವೇ ಸೆಲ್ಫ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಈಸ್ ಸಮ್ಟೈಮ್ಸ್ ವೆರಿ ಡೇಂಜರಸ್. ಓಕೆ ಓಕೆ ಹೌದೌದು, ಒಳ್ಳೆಯದು. ಒಂದ್ಸಲಿ ಚೆಕಪ್ ಮಾಡಿಸಿ. ಸಿ, ದೇ ಮೈಟ್ ನಾಟ್ ಡೂ ಎನಿ ಇನ್ವೆಸ್ಟಿಗೇಷನ್ ಟೆಸ್ಟ್ ಅಲ್ಲ, ಜಸ್ಟ್ ಒಂದು ಡಾಕ್ಟ್ರು ನೋಡಿದ್ರೆ ವೆದರ್ ಇಟ್ಸ್ ಎ ಮಸಲ್ ಪ್ರಾಬ್ಲಮಾ, ಇಟ್ಸ್ ಬಿಕಾಸ್ ಪೋಸ್ಚರ್ ಪ್ರಾಬ್ಲಮಾ, ಸಮ್ ಎಕ್ಸಸೈಸಸ್ಸು, ಅಷ್ಟೇ ಸಾಕಾಗುತ್ತೆ. ಓಕೆ ಓಕೆ,
thank you so much. Well, thank you, sir. She had a similar complaint saying that we should never neglect the problem, sir.
Yes.
Thank you for letting us know, sir. So now we're almost running out of time, sir. So a few points, sir, what you would like to educate the general public regarding the common problems, when to seek medical care, and what treatment options are available, and something about the facilities in our hospital, sir, which can help the general public, sir, to end the show.
See, as far as this program is concerned, see, our whole discussion has been on osteoarthritis, osteoporosis, and spine problems. See, there are modifiable risk factors: healthy lifestyle, exercise, good physical activity. That itself will prevent most of the problems. So I would tell everybody to be active, do some good physical activity, keep your weight under control, avoid sedentary activities, take care of good postures. That itself is the main this one. Yes, when you have a problem persisting for a long time, you should consult a doctor, find out the problem, don't neglect it, and go at a last, means advanced stage where surgery is this one. So when in the initial stages we find out problems, everything can be slowed down. Osteoarthritis can be slowed down. It might not be reversed, it can be slowed down. Osteoporosis, you can prevent fractures. You can prevent refractures by treating Understand? Many of the time they present with fracture. If you identify osteoporosis in a fracture patient, the treatment is to prevent next fracture. Within next 1 year, 2 years, they might have a fracture if you neglect it. So treatment, you start it. Similarly, back pain, take care of good postures, good back exercises, strengthen your core back muscles. Most of the things are modifiable. Yes, as far as our department and this one, yeah, we extend all the facilities. With the Silver Jubilee, we are catering to almost all categories of society, giving advanced surgeries at government tariff rates. With the addition of robotics, we want to give it to all the patients who are needing, with the spine endoscope, minimal access surgeries. So I think they should utilize our services, which we have been extending for a very long time. Through this program, I would like to extend welcome to everybody to utilize our facilities.
Thank you so much, sir, for the enlightening session. I would like to say thank you, Vydehi Institute of Medical Sciences, for giving us an opportunity to enlighten the general public on the same. So this is your host, Dr. Nishant, and our guest, Dr. Hiranya Kumar, signing off. We'll join you in the next future time. Thank you very much.
Thank you.
Thank you.
One of the most frequent causes of leg and back symptoms is a herniated disc. Here, high forces can cause the outer fibrous ring to rupture and the fibers and core material to exit into the spinal canal. First, a guide wire is used to ensure the correct positioning of the instruments. Thanks to special instruments and devices such as the dilator and working sleeve, this procedure offers the most minimally invasive approach compared with conventional methods. An essential component is the endoscope, which guarantees optical control of the treatment at all times. This allows the procedure to be performed safely and easily.
Years of healing hearts, saving lives, and serving communities. And now, as we celebrate this milestone, Vydehi Hospital, Whitefield, Bengaluru brings you something truly special. Because quality healthcare should be accessible to everyone, not just a few. Introducing high-quality surgical care at remarkably affordable costs. Surgeries priced to match government scheme tariffs, with eligibility extended to all patients. From general surgery and orthopedics to ENT, oncology, neurosurgery, urology, and more, all under one roof. Celebrating 25 years of excellence and a lifetime of care. ಹೃದಯಗಳಿಗೆ ಹೊಸ ಜೀವ ತುಂಬುತ್ತಾ ಅನೇಕ ಜೀವಗಳನ್ನು ಉಳಿಸುತ್ತಾ ಸಮುದಾಯದ ನಿರಂತರ ಸೇವೆಯಲ್ಲಿ 25 ವರ್ಷಗಳ ಪಯಣ. ಈ ಮಹತ್ವದ ಮೈಲಿಗಲ್ಲನ್ನು ಆಚರಿಸುತ್ತಿರುವ ಸಂದರ್ಭದಲ್ಲಿ ಬೆಂಗಳೂರಿನ ವೈದೇಹಿ ಆಸ್ಪತ್ರೆ ವೈಟ್ ಫೀಲ್ಡ್ ನಿಮಗಾಗಿ ವಿಶೇಷ ಯೋಜನೆಯನ್ನು ಪರಿಚಯಿಸುತ್ತಿದೆ. ಗುಣಮಟ್ಟದ ಆರೋಗ್ಯ ಸೇವೆ ಕೆಲವರಿಗೆ ಮಾತ್ರವಲ್ಲ, ಪ್ರತಿಯೊಬ್ಬರಿಗೂ ಸಿಗಬೇಕು ಎಂಬ ನಮ್ಮ ಪ್ರಯತ್ನ. ಅತ್ಯುತ್ತಮ ಗುಣಮಟ್ಟದ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆಗಳನ್ನು ಈಗ ಅತ್ಯಂತ ಕೈಗೆಟುಕುವ ವೆಚ್ಚದಲ್ಲಿ ಪಡೆಯಿರಿ. ಸರ್ಕಾರಿ ಆರೋಗ್ಯ ಯೋಜನೆಗಳ ದರಗಳಿಗೆ ಅನುಗುಣವಾದ ವೆಚ್ಚದಲ್ಲಿ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆಗಳು ಮತ್ತು ಈ ಸೌಲಭ್ಯಗಳು ಎಲ್ಲ ರೋಗಿಗಳಿಗೆ ಲಭ್ಯ. ಜನರಲ್ ಸರ್ಜರಿ, ಆರ್ಥೋಪೆಡಿಕ್ ಚಿಕಿತ್ಸಾ ವಿಭಾಗ, ಕಿವಿ, ಮೂಗು, ಗಂಟಲು ವಿಭಾಗ, ಕ್ಯಾನ್ಸರ್ ಚಿಕಿತ್ಸೆ, ನರಶಸ್ತ್ರ ಚಿಕಿತ್ಸೆ, ಮೂತ್ರರೋಗ ವಿಭಾಗ ಸೇರಿದಂತೆ ಹಲವು ವಿಶೇಷ ಚಿಕಿತ್ಸೆಗಳು ಒಂದೇ ಸ್ಥಳದಲ್ಲಿ. ಅನುಭವಿ ತಜ್ಞರು, ಆಧುನಿಕ ಶಸ್ತ್ರಚಿಕಿತ್ಸಾ ಕೊಠಡಿಗಳು, ವೇಗವಾದ ಚೇತರಿಕೆ ಹಾಗೂ ಸಂಪೂರ್ಣ ಆರೈಕೆ. ವಿಶ್ವಾಸಾರ್ಹ, ನಂಬಿಕೆಗೆ ಪಾತ್ರ, ಕೈಗೆಟುಕುವ ದರ, ಪ್ರತಿಯೊಬ್ಬ ರೋಗಿಗೂ ಶ್ರೇಷ್ಠ ಸೇವೆ ನೀಡುವ ಬದ್ಧತೆ. ವೈದೇಹಿಯಲ್ಲಿ ಆರೈಕೆ ಎಂಬುದು ವಿಶೇಷ ಹಕ್ಕಲ್ಲ, ಅದು ಪ್ರತಿಯೊಬ್ಬರ ಹಕ್ಕು. ವೈದೇಹಿ ಆಸ್ಪತ್ರೆ, ವೈಟ್ ಫೀಲ್ಡ್, ಬೆಂಗಳೂರು. 25 ವರ್ಷಗಳ ಶ್ರೇಷ್ಠ ಸೇವೆಯ ಸಂಭ್ರಮ. ಆರೈಕೆ